So what's your take on emergency contraceptives?
Emergency contraceptives, I think they are good when taken properly, but taking it consistently, I think that's very bad, very, very bad, because I think that is just an emergency pill that should be taken once, maybe in a year or twice in a year. But I know some friends, some people who take it constantly, and then they think it is healthy. It is no good at all. Me, I don't even take it because I've taken it once and then it changed my menstrual cycle, and then the pain I experienced during my menstruation. So I'm not saying it's not good. It saves a lot of people, but it should be taken wisely, like the right way. That's it.
Hi guys, it's your favorite personal pharmacist here, Dorothy. Once again, meet here for just in time, and I'm happy to have you guys here. This video almost did not happen because this week I wasn't really in the mood to be a pharmacist, but we shall overcome. So today I'm going to talk about coitus. That just means sex. Right now, postpills are like the savior of our generation. Like everybody's taking it. That's the down truth. Like every single, no, I'm not going to be prejudiced and say every single. Most people are taking it. They're taking it like water. You're having some action, good for you, yeah, you. But then if you are abstaining because you're saving yourself from marriage too, great, keep up the good work. Okay, now if you are here because your condom broke or you just had an unplanned sex, gather around. I have an intervention for you. Let me introduce the famous post pill.
2, 1.
First of all, it contains the compound levonorgestrel, just very similar to the compound in most daily contraceptives. However, the only difference is that in the post pill there are higher doses, like there's a higher strength compared to the daily contraceptives. Okay, so it works by two mechanisms. One, it works to delay ovulation. Of course, if you don't release eggs, then the sperm can't fertilize it, then there's no baby. Very simple math. The second method it uses is thickening the cervical mucus. Okay, so of course, if the sperms find it hard to swim to get to the egg, once again, no fertilization, no baby. Now, most of the post pill packs come in the 1 tablet form, but then some have the 2 tablet form, like the Postinor. Okay, with the 2 tablet form, you can take both tablets at the same time. Doesn't really matter. With the 1 tablet form, of course, it's just 1 tablet, so you just pop in the pill and you're good to go. It can be taken on an empty stomach or after a meal. Okay. So there's some downsides of taking post pills. You can either make your menses come a week earlier or a week later. Okay, so when you see that, don't fret, don't be too anxious. However, if it should delay 2 weeks from the expected date of your menses, then you have to take a pregnancy test kit to find out whether the medication worked or not, right? Okay, another thing it causes is that breast tenderness. Okay, so it makes your breast painful. So you realize that you bend down, you have a lot of pain in your breast, or when you touch your breast, so for the literal example, touching your breast becomes very painful. It's just a side effect of the post pill. And another side effect is it can cause spotting or bleeding just a few days after you do take the post pill, especially if it's your first time. Okay, so when you see that, don't be too scared, don't be too alarmed. Sometimes it can even cause it anytime during your cycle, not necessarily just after you take the post pill, but then anytime during your cycle. However, what the post pill won't help you with is this. Number one, it's not going to cause an abortion. Nope. If you're already pregnant, there's no point in taking a post pill. It's a done deal. It's not going to cause any abortion. Number 2, it's not going to prevent any sexually transmitted infection. If you have an STI, gonorrhea, HIV, chlamydia, and you do have unprotected sex, the post pill is not going to prevent you from having an STI. So, to the juicy part of today's conversation, is it okay to take multiple Plan Bs? Literally, is it okay to take multiple post pills? Now, technically, yes, it is. The leaflets have never said anything that you cannot take beyond this number of pills. However, this is where the tricky part is. It causes period irregularities. Now, whenever you take a post pill, it pushes your ovulation days 5 to 7 days beyond what it was expected. So now, if you're supposed to ovulate on the 5th, right now, and if you took your post pill before ovulation, you're probably going to ovulate 5 days later, 7 days later. It's not a fixed number of days, but usually 5 to 7 days after you're taking your post pill. That means that your period might also delay, and if you take multiple pills in a month, so imagine you delayed by 5 days the first one, the second one you delayed it again by 5 days, it's going to cause something called anovulation. So some people go for months and they haven't seen their period. This is why. This also means that you can actually be ovulating and you will not know it. So you might think, oh, you are safe because you don't menstruate. Girl, if you do have unprotected sex, you can't get pregnant. So the post pill is actually making you pregnant. The reality of life. Okay. Now these post pills also, because they are high doses of hormones, can cause bleeding. Sometimes people don't just spot, people actually bleed irregularly. It can go on for days, and of course, if you bleed too much, of course, you know it can cause anemia. You know it can cause some deficiencies in iron and all of that. Now, if you are on certain antibiotics or any antibiotic course, or taking medications for the treatment of HIV or some anti-seizure medications, that is, if you have epilepsy and you are taking medications for that, it can reduce the amount of post pill in your body. So in that case, your post pill doesn't stay long enough in your body, and hence it doesn't work. So if you are taking post pills, do not take an antibiotic. Talk to your pharmacist, your local pharmacist, or your personal pharmacist, and find out which solution will be best, which timings will be best to prevent unwanted pregnancies. Okay, so I think this is a wrap for today's session. I hope you enjoyed it. Today was very fun. Yeah, and if you have any more questions, do put it in the comment section. Basically, what I'm saying is, take your post, but take it with sense. Don't use your post pill to replace the daily contraceptive. Talk to your pharmacist or your doctor about a daily contraceptive to use. Every day can't be an emergency. Please stop kidding yourself.
I want to see for myself. Nah, I'm just playing. I'm gonna listen this time. I'm gonna listen.